everyone, Amina here with the Float Smell Business Podcast, speaking with Dr. Dana Lerman, an infectious disease physician who's consulting with businesses on how to reopen safely from a highly medical perspective. Well, first of all, thank you. I think that this is going to be a really helpful conversation because it seems like there are so many misconceptions. People aren't quite sure where to put their attention, whom to trust. So many mixed messages that I think hearing from a medical professional is going to be so valuable. So thank you.
Sure thing. Great. Thanks for having me.
Yeah. So with your experience that you've been having over the last few weeks, few months, are people in general doing it right when it comes to reopening and re-engaging with customers and employees? Are they, for the most part, doing it right, or are you seeing some major holes?
I think it's a mixed bag. I think that there are a lot of people doing it responsibly and following all of the guidelines, or trying to as best as they can, because there are many of them.
Right.
I think that, besides being a COVID consultant, I'm also obviously a consumer. Some places that I've been to, banks specifically, that I was really concerned about when I walked in, and it was almost like nothing had happened. The only change that I had seen in this one particular bank that shall remain unnamed, was that they were wearing masks, and there was one plexiglass divider between the bank teller and myself. So, in terms of the ATM that was outside, right in the little hallway, when you walk into the bank, there's the ATM. Mm-hmm. There was no hand sanitizer. There was no wipe down the ATM. There was nothing. There was no signage on the door about what's expected once you walk into this particular bank. It was really unfortunate to see that. No masks required or recommended. There was no signage.
And you feel like signage in businesses is going to go a long way in helping remind people, or do you think it's just for show?
I think signage is helpful, but the signage has to be appropriate. I've been to places where there's literally 10 signs on the front door. Guess what, people? No one is reading those. No one. One sign. Here's the sign. This is what we expect. And it shouldn't be a standard paper. It should be a big sign. Laminate it. Put it in the window and make it readable, and explain to people what you expect inside of your facility from your employees and from your customers and clients that come there.
Yeah.
These are our rules. This is what we expect of our community.
Yeah. From what I can tell, a big problem is there's more uncertainty now than there has to be.
Totally. It doesn't have, I often reference Genesis's song Land of Confusion. And to me, if you go back and you look at the list, read the lyrics of that song, that to me is so demonstrative of what is happening now. It doesn't have to be so confusing.
Right.
It doesn't have to be that way. And I mean, I think that the people who are instituting the guidelines have to understand that these are human beings and these are people, and you have to be realistic and understand the population that you're dealing with. You cannot go and, ask everyone to do things that are next to impossible.
Yeah.
And when we go and do consultations for places, that's one of the first things that we say is that, we are not, a lot of people don't want to call us because they're worried that we're going to give them even more information than the CDC says and be stricter about the guidelines. And we are not that way at all. We try to make sense out of the guidelines, and we critically evaluate them. I mean, the CDC says children over the age of 2 should wear a mask, but they also don't comment on, well, what about when that child is napping, right? That's dangerous. So, when we've done consultations for churches, they have daycare centers there, and we talk to them about that, and we try to be realistic, and, we leave it to them. We're consultants and we give recommendations,
right?
But we also, you have to step back and say, well, does this make sense?
Yeah.
Because you're doing all of these other measures, right? You're counting on the parents to not send a sick child in. They're temperature screening, everyone's hand washing. They're trying to keep the children socially distant. So you have to imagine that decreases the risk somewhat of a transmission in that facility. And then, the medical community also gets worried about people constantly manipulating their masks,
Right. Yeah.
Because that is a way that some think that the virus can be transmitted.
Right. The other thing that adds to the confusion, I think, is that the WHO sometimes contradicts the CDC and vice versa. And it's hard to know whom to trust. And I fear that there are some people who think it's actually a conspiracy. It's not that we don't know enough. It's not that we don't agree. It's that it's actually nefarious. And what do you have to say to those people?
So I think that, the WHO has different guidelines in terms of what is a fever. So a fever to the WHO is 99.1. And a fever to the CDC is 100.4. So when you're going to let someone in your yoga studio, are you going to let them in with a 99.1? Or not, you know what I'm saying? So it's who are you going to listen to? And so for us, from an infectious disease standpoint, and a virus that is so contagious and really has the potential to do a lot of harm, we err on the side of caution with that recommendation and go with a 99.1 because a large majority of patients with coronavirus, almost half, don't even have a fever.
Yeah.
So you can pick up something more easily if you lower that fever threshold.
Right. Okay. So just because somebody doesn't have a fever doesn't mean necessarily that they're healthy, but those people who have a fever, you can safely say, you should probably stay home. You should definitely stay home.
Right. Yeah.
Well, I think one thing that the community is dying to know is how do we clarify some of these protocols, some of these recommendations. So can we talk for a really quick minute about maybe the top 2 or 3 recommendations you have for businesses? What's the low-hanging fruit? You say that it doesn't have to be complicated. How can we really simplify this for businesses? What should they be doing as they open up?
So, I think the low-hanging fruit is the stuff that we already know, unfortunately. There's not one little tip that I could say. It's wear a mask especially when you're indoors and you're in public. I mean, when you're around other people, it's not just for you. It's not for you. It's for someone else. It's in the event that you have coronavirus, you don't know yet, you're not exhibiting symptoms.
So wear a mask and wash your hands all the time. Those are pretty much the 2 things I keep hearing. Yeah.
Wear a mask, wash your hands, and just distance. It's not, it's hard, but once you start doing it, you just get into this groove, and then you feel someone coming into your space and you kind of stand back. You will learn how to behave this way, and it will be really challenging for us all to go back to the old way that we used to communicate with people.
So in our community, and I assume that this is all across the United States, personal service workers like massage therapists, like estheticians and stuff like that. I know that in our neck of the woods, they were included in phase 1 reopening. And that was a challenge for them because you can't wear a mask when you're doing dermal fillers or doing somebody's makeup or you're cutting their hair. You can't have 6 feet of distance if you're cutting somebody's hair. And so a lot of those businesses were speaking up and saying, hey, we don't feel safe going back to work. However, if we choose not to, because we are in phase 1, we will no longer qualify for unemployment insurance. And so we're stuck in a hard place here.
Yeah. So that was ridiculous.
So then, okay. So for those businesses then that have to go back to work because they have no other financial choice, what can they do to stay safe?
That's really a tough thing. I mean, it's the more layers of protection you add on, the more protected you are, right? So if you're screening your employees and you're screening your clients and your expectations are clear and you communicate with people, that's one level. And then you go in and you wear a mask as much as you can, that's another level. And you washing hands and hand sanitizing, that's another level. There's all of these things, and you take off one level and then your risk goes up. And you take off another level and your risk goes up. So it's hard to say. Nothing be risk-free unless you sit in your home and you don't ever go anywhere and you have no exposure at all, and including an Amazon package that arrives at your doorstep, or right?
Yeah.
But it's a cumulative risk. And I think you have to establish whether or not the benefits outweigh those risks. And that's an individualized decision for every business. Nothing is without risk, especially in those situations.
But I like that it almost makes it feel much more concrete and mathematical, that if there are 3 main interventions, masks, distance, and hand washing and sanitizer, if there are 3, to me, it's uplifting to know that those are the 3 most important measures, like that, the low-hanging fruit, and that there will be times when one of those 3, hopefully not more, needs to be compromised, but maybe we compensate in other ways in order to keep ourselves safe. I think that alone is going to be really important for businesses and consumers to realize that if you can't keep your distance because your job just doesn't allow for it, because you're cutting hair or something, at least both of you can be wearing a mask. And if you can't be wearing a mask, then maybe you practice distance, or maybe you're hand washing, or you're doing something else.
Nothing's perfect. But you have to think that if you try your best and do as many of those things as you can, you're going to have an added layer of protection.
Right.
With each thing.
Yeah. Well, hopefully that'll be just reassuring enough for people that they can go out responsibly, but not so reassuring that it becomes irresponsible.
Right.
It's a balance. Yep. So if there were one thing that you could just megaphone to the entire world, what would it be?
I think what I would try to tell people is to just really, it's not about you, and you just have to try to do the best that you can as a human being, the best that you can for your neighbor and your grandparents and everyone else around you.